and death. Frankly, it's a matter of life and death.
President Trump warned Americans the worst is yet to come.
This could be a hell of a bad 2 weeks.
The number of cases has not even peaked, and top health officials told people to prepare for the reality that 100 to 240,000 Americans could die, and that's with mitigating efforts.
This is the thing that we need to anticipate, but that doesn't mean that that's what we're going to accept.
Doctors Anthony Fauci and Deborah Birx pleaded with the public to stay at home, avoid travel, and cap gatherings at 10 people.
This is tough. People are suffering. People are dying. It's inconvenient from a societal standpoint, from an economic standpoint to go through this. But this is going to be the answer to our problems.
There's no magic bullet. There's no magic vaccine or therapy. It's just behaviors.
Just last week, President Trump said he hoped Americans would pack into church on Easter. And for weeks, he told them the virus was not as bad as the flu.
The flu in our country kills from 25,000 people to 69,000 people a year. That was shocking to me. And so far, if you look at what we have with the 15 people, and they're recovering. One is pretty sick, but hopefully will recover. But the others are in great shape.
But now, Mr. Trump is sending a very different message.
A lot of people have said, a lot of people have thought about it. Write it out. Don't do anything. Just write it out and think of it as the flu. But it's not the flu. It's vicious.
New York Governor Andrew Cuomo says governors are still betting against each other for medical supplies like ventilators. 2 weeks ago, President Trump said states should try to get them on their own. But yesterday, he said the government has 10,000 ventilators ready to go, but they are waiting to ship because the surge is coming. And they want to make sure to send the machines to the right places when it does. Gail?
Just simply pray this prayer. God, I'm a sinner. I'm sorry for my sins. I believe Jesus Christ is your Son, and I want to invite him to come into my heart, into my life. I'm willing to trust him as my Savior and follow him as my Lord. And I pray this in Jesus' name. If you pray that prayer, call this number that's on the screen. Do it right now. We've got someone who'll pray with you, talk with you, encourage you. God bless.
Can get it. This virus spreads even without symptoms. Stay home and stay safe. Be apart now so we can all be together later.
In retaliation after staging a walkout in New York, the company says he was fired for violating a mandatory quarantine.
I just want to make sure I get all this straight. All the managers at your facility were told that somebody had tested positive.
Right.
Were you then instructed as a manager to tell everybody that worked under you?
No, it's like keep it on the hush. Don't tell everybody. They don't want to cause a panic. They want to keep business operations running. It was crazy to me.
Amazon told CBS News that it informs employees who've come in close contact with coworkers who've tested positive and directs them to stay in quarantine for 2 weeks with pay.
There's people sick in the building and not caring about this pandemic, this epidemic, this virus.
But Chris Smalls, who was among more than a dozen Amazon employees to protest unsafe work conditions on Staten Island Monday, says the company isn't being forthcoming.
What do your colleagues at this facility say?
I mean, some people are afraid, but they still just, I need the money. And the double time is blood money.
As Americans lean heavily on services that help people live remotely, health concerns and fair pay are paramount for employees who feel more pressure than ever to deliver.
We don't have face masks. We ran out of those weeks ago. The cleaning supplies that they claim they have all over the place, we don't have those either.
We do not feel safe working there right now. We are actually part of the problem and not part of the solution.
This Amazon employee, who asked that we only call her by her first name, Rachel, sorts packages part-time at the company's Teterboro, New Jersey facility.
Blue.
Rachel's a single mom and says she and her 1-year-old son have a history of respiratory issues. She tells us there were rumblings about potential cases in Teterboro more than a week ago, but on-site management had no answers.
I did get the hearsay, which I was told from a member of safety that I should take it with a grain of salt. I shouldn't listen to other people. I then had reached out to a member of the executive team at the corporate office in Seattle. So she says, listen, your site said that they are aware of the situation. Written communication will be out shortly. There was no written communication, and until this day, they have not had any written communication, and that's concerning.
Amazon told us that it communicated with Teterboro employees as soon as they knew of a confirmed case, and that Rachel's allegations are not representative of the company's commitment to safety. She's not convinced.
You have to choose whether to collect the paycheck or our health. I want the company to really truly put the health and the safety of their employees first.
Chris Smalls also claims that even after symptomatic employees get tested, they can return to work while they await their test results. Now, Amazon says it tells employees to go home if they're not feeling well and consult with the doctor. The company, which also owns Whole Foods, says it's complying with all CDC and World Health Organization guidelines. As for the food delivery app Instacart, it says the health and safety of its entire community is its top priority. Gail?
Realizing that they lock up Black and brown people 5 times more than white people, and I am raising mixed kids, to me that becomes really personal.
I think people should see the work that you put into it. You go to the prisons, you meet with the inmates, you meet with their attorneys. Why are you doing this?
I just couldn't sit back and see Alice spend the rest of her life in prison. When I saw that she had her big family and her sisters and her grandkids, and it just reminded me of my family. And I thought, what if one of us made a decision that just changed our family for the rest of our lives? Once I really got to know Alice and realizing that there are thousands more Alices, I couldn't just sit back and not try to make a difference and not try to change.
You know, you said something very powerful in your documentary when you said you have to ask yourself, are human beings capable of transformation and second chances?
Absolutely started this process. I didn't think I had the empathy to support and rally behind someone that had taken someone's life when there was a violent crime involved, until I started to educate myself and until I started to go to prisons and meet with people that are incarcerated.
How do you find the time to do that with all that you also have to do with your own family life?
Well, it is a huge change in my personal life. I never go to events. I never go out. I just don't have the time.
You never go out?
Rarely do I go out. I have to be home. I mean, I have to be
stay at home.
Studying for law school 18 hours a week. So I really did make that commitment. If I have to study, everyone really does respect that.
What would your dad say, Kim? Your dad, Robert Kardashian, was a very famous attorney. What would your dad say?
Well, him and I talked about it a lot. I know he would be really proud. And I think knowing that he's pushing me to not give up.
People all know Kim Kardashian. We all watched you growing up. Is there a part of you that says, I don't want people to think of me that way anymore?
I can honestly say that I don't care if someone views me as this way or that way or however. I just know what I'm doing and I'm focused on that. And I love being a mom and I love being a good example for them.
You've got 4 children. How are you navigating coronavirus?
We're all at home. We've watched every single movie under the sun. We're doing drawing classes, everything you can imagine to try to keep kids busy.
And how is Kanye handling coronavirus, this pandemic, and social distancing?
Yeah,
he's always very active.
I thought that he'd have a harder time with it, but he really does love staying at home and watching movies and having my cooking and hanging out with the kids. I think this time we're just taking advantage of it and trying to be positive. I've probably annoyed him organizing every last thing in the house.
Not heeding the call about social distancing. This stuff is no joke.
Yeah, I think that it's extremely irresponsible for anyone to not take this seriously. The sooner we do this, the sooner we can go and see our friends and family again.
The FDNY is now facing a record number of ambulance calls, well over 6,000 on Tuesday. Ambulances can be seen lining up at hospitals around the city, with 20% of EMS workers out sick. The FDNY is offering crews lodging in the city to lower the risk of spreading the coronavirus. to their families. Some much needed relief, though, appears to be on its way to the city to help with the transport of patients. One of our crews spotted several out-of-town ambulances on the Cross Island very early this morning, making their way into New York City. So some good news there. The cavalry is on its way. All right, now let's get a check of your forecast and get over to Elise Finch live with the Mobile Weather Lab this morning in front of the CBS Broadcast Center. Hi, Elise.
Hey, Chris, good morning to you. So we have been hovering between the low 30s and the low 40s across the tri-state area this morning. It is a cold one and windy as well. Here at the back of the Mobile Weather Lab, we're currently getting a reading of 41.5 degrees with the wind feeling more like 37, 38 degrees. It's sort of alternating there, but it is cold. So if you're heading out, you want to bundle up. I want to go ahead and show you the forecast high for today. We do get a pretty decent warm up. We're expecting 54 degrees for a high, partly to mostly sunny skies. A little bit breezy even when we hit that high temperature. Your 7-day forecast shows that we will be hovering right around the mid-50s through the weekend with a chance for rain late Thursday into Friday and again on Sunday. Chris?
Elise, thanks so much, and stay with CBS 2 for continuing coverage of the coronavirus crisis. I'm Chris Raggi. Stay with us all day here on CBS New York and CBSNewYork.com. Remember, social distancing, it is a must. And remember, we're all in this together. Stay with us.
Everyone ought to be wearing a mask when you go out. If you're not with your family at home or the people you're isolating with, when you go out, you should wear a mask to protect yourself and protect others. The issue with this is that there just aren't enough masks, at least in the United States. Even if everyone said, yes, I'm with it, let's do it, let's wear those masks, there aren't enough masks to buy. And so actually, if you go on YouTube now, you will see lots of videos instructing you on how to make your own masks. Some of them actually by doctors and health systems. I looked at them, it was actually, I'm no seamstress, but it was actually surprisingly easy how to do it. It's difficult to know how many of these instructions are reliable and how many are not, but I was surprised to see how many were actually from doctors.
New realities and shortages.
So these are what are called PAPR hoods. So these are the hoods that hook up to these machines that filter air.
That's the hose that hooks up to the back of the hood.
They do get cleaned inside and out, so they can be reused. Because the way they were built was for one-time use, but that's not the way. If we did that, we would already be out.
Wow. They have completely revamped 2 intensive care units.
So this whole unit was meant to be for people with brain injuries and strokes and so forth, and so now we have to move all them someplace else because we have to continue that care.
So all the people with brain injuries were moved and this was turned into a COVID-19 ICU unit.
Correct.
All to try and help coronavirus patients live, isolate them from others, and keep the staff safe too. So I am not wearing the full personal protection equipment because in these rooms where the actual COVID-19 patients are, these are considered negative pressure rooms. That means that we are considered in a safe space, not wearing full personal protection. Patients are being cared for, but we don't need to wear the full apparatus unless you are a doctor or nurse who has to go into the room to care for the patient. Inside the rooms, patients are hooked up to a shocking number of tubes, using those precious ventilators, the only thing keeping them breathing.
So for the ICU patients, they get very sick and they stay sick very long. So needing to require the ventilator for weeks at a time, and that's really the big issue.
Across just their 4 hospitals, 60 coronavirus patients were hospitalized last week. Already this week, it's at least 100. For each one, a delicate dance to keep staff healthy and patients alive. It is just coming in here and seeing the work that's being done and seeing the patients being cared for. It's stressful. I'm scared for their families as well. And so as you walk through and you see the hard work being done and people doing everything they need to take care of patients, it's awe-inspiring, considering the fact that they too could be putting themselves in harm's way. Outside the hospital, a large tent has been erected to assess and test potential coronavirus patients. And this is happening before the anticipated surge here. I feel dread and I feel fear, and I'm not working on the front lines. What are you feeling as you're dealing with all these COVID-19 patients?
It's certainly a sense of anxiety because right now, we're kind of wondering what it's going to be like when that comes and when people are flooding in.
While the number of new infections in Washington seems to be slowing down, there's a growing sense they haven't seen the worst of it yet.
What they do every day is heroic. Going and taking care of patients without protection is not acceptable.
Well, Sarah Seidner joins me now live from Washington. Once again, amazing reporting here. And really, we got a sense of the emotional toll as well that this is all taking through you on some of these medical professionals. How are they coping? Because they're on the front lines, and we've seen doctors and healthcare professionals in some cases lose their lives as a result of being exposed to this virus. What are they telling you about the road ahead?
Yeah, Hala, we did have those conversations with one of the nurses there, and he basically said, look, there are a couple of things happening here for us. One, we wonder if we're in the eye of a hurricane and that the other half of the hurricane, the one that tends to hit you harder, is still coming. And there's this sense of anxiety and dread that there's suddenly going to be a surge of patients. And they have all these checklists, right, that they have put on the outside of each patient's door to make sure that they don and doffed all of their equipment properly so that they don't contaminate themselves. But if you have a surge of 100 patients, say, in a few days, how do you continue to do that and care for the patients when they need immediate care? So there is definitely anxiety about that. The other big anxiety for them is going home. The last thing they want to do is infect their children, their wives, their husbands, their parents, their grandparents. For those who live in a household that has many people in it, they are terrified of coming home, walking in the door and contaminating their loved ones. And so they're taking extra precautions, even wiping the bottoms of their shoes, leaving their shoes outside, just to make sure that they're not contaminating those who are in their own communities and in their own homes, Hala.
Yeah, it's a good point. And added anxiety. They don't have to worry about that when they're treating other illnesses, but they have to with this one. Sarah Seidner, as always, fantastic reporting. Thank you so much. Sarah was talking, and we were talking with our other reporters about some of these containment and self-isolation measures that are being put in place around the world. Well, in Denmark, street buses, town centers, and even